Ladies and gentlemen, thank you very much for giving me the opportunity to be with you digitally at the second European Conference on LGBTI health. I'd like to begin with what brings us together, which is a shared mission: making health systems truly accessible, respectful, and equitable for everyone, including LGBTI people. As a Minister of Health, I'm committed to ensuring equal access to care for everyone. And once such access is guaranteed, the quality of care must be just as high for vulnerable people as for anyone. And this requires more than just resources. It demands an understanding of people's specific situations and realities. In that spirit, I value and I support the community-based approach to health, designed by and for the communities it has to serve. These initiatives often reduce significantly the cultural, social and psychological barriers that LGBTI people face when seeking care. When health services are tailored to the real needs of individuals and are delivered by people who genuinely understand their realities, they become not just a source of care, but a source of dignity. Belgium is proud to support such models. In fact, we have two different approaches in parallel. The Rainbow House in Brussels has a centralized approach. Health, culture, well-being come together in this one truly inclusive space. It is a result of collaboration between expert organizations with public funding at community level. As a matter of fact, it's the first state-supported medical center in Belgium focused specifically on the needs of LGBTI individuals. In Wallonia, we are testing another model, a decentralized approach. Because inclusion must not be limited to big cities. This model is based on several LGBTI community centers, twinned with local medical houses in each province. This proximity-based approach ensures that LGBTI people are welcome, they are understood, and cared for no matter where they live. These initiatives are based on the understanding that when care providers engage with communities, respond to their realities, and adapt their practices accordingly, healthcare becomes not only more efficient, but also more compassionate and equitable. Another simple yet frequently forgotten reality is that LGBTI health is about far more than just sexual health. Too often, LGBTI individuals have been viewed narrowly through the prism of their sexuality, reducing thus their identities and needs. But health is holistic. Every person, regardless of their gender identity or sexual orientation, deserves to feel safe, welcome, and respected in any healthcare setting. No one's identity should ever be a barrier to seeking the care one needs. A topic that is particularly close to my heart is mental health. We know that many people are struggling, especially in the LGBTI communities. LGBTI people are disproportionately affected by anxiety, depression, and other mental health challenges. not because of who they are, but because of the discrimination, isolation, and violence many still face. Mental health services must be inclusive and accessible without fear of judgment. For the last 4 years, we've been working to integrate mental health support more effectively into primary care with a special focus on young people, and I think such investment was really very important for everyone, including also for LGBTI people. At the same time, we must continue addressing sexual health with determination and clarity without taboos. Unfortunately, we are seeing the number of infections rising, so we must strengthen our efforts, which is why we will continue to implement our HIV plan. Our priorities are to further reduce the number of new HIV infections and, above all, to ensure faster diagnosis of those affected. We have also relaxed the reimbursement rules for PrEP. Looking ahead, in collaboration with the federated entities in this country, we are exploring ways to make PrEP more accessible to vulnerable groups. As part of this, we are examining the possibility of allowing general practitioners, not just specialized centers, but also general practitioners to prescribe PrEP for the first time. We will continue to work closely with LGBTI associations to ensure that information, testing and treatment reach those most at risk. I remain deeply committed to supporting initiatives that promote high-quality, accessible healthcare for all. The path towards fairer and more inclusive access to health for LGBTI people requires informed action and strong collaboration between policymakers and stakeholders. That is why, even though I cannot be with you in person today, I think it was important to share these words with you. Our dialogue must remain open and ongoing. Together, let's keep moving forward, guided by evidence, inspired by community, and united by a belief in universal health care. Thank you very much.